Hi, my name is Dr. Daniel Fox. I'm a licensed psychologist in the state of Texas and an expert in the area of personality disorders. And a lot of folks have been writing me about the clients that I've had that have been successful, that have overcome a lot of issues related to BPD, and those that have beaten BPD. And I thought, let's do a video to help you with those identifiers and those markers. And I think that a good example of that is car commercials, right? Because in car commercials, that they don't show you what the car looks like when it's in repair, right? But they show you what it looks like when it runs great. Now in mental health, we don't do this. Why don't we do this? Why aren't we setting up markers or identifiers so that clients and individuals know what to look for? What are indicators? And a lot of times that's because it tends to be very individualized, which I certainly understand. What about general markers? And we're going to talk about that as it relates to BPD today. I think that building insight and understanding, I think there is a lot of benefit to doing this, particularly for those with BPD, because it can be a very confusing disorder. And for those that have it, or you may have a loved one who has it, who struggles with issues with BPD, it is very confusing. And building that insight and understanding can give you the tools to manage it. And so what we want to do is I want to give you the tools and let you know what your car, your BPD, what you can look like, right? Once you've beaten your BPD, what your brand new car, which is you, looks like, right, when it's running well. First off, I think that it's important to know that it is possible to overcome BPD. It is possible to beat BPD. It is not a life sentence. It is not something that you have to live with your entire life. The research supports that. My clinical experience supports that. A lot of other folks that I know and colleagues of mine have also experienced that as well. I think a big problem, I've mentioned in other videos as well, is that we tend to only define BPD by the extreme, and we'll say that's the extreme 10%. But the problem is you have the other 90% of individuals who have traits of BPD, who meet full criteria for BPD, but they're not being diagnosed because I think the mental health profession is only looking at that 10%. And if we're only looking at that 10%, that is a big problem because we're missing obviously the 90%. And I think that if you look at the comments to a lot of my videos, if you notice the interactions, the responses that I get, of course you wouldn't know that, but the responses that I get are very positive about people who do want to work on this, who do want to be successful, who are able to overcome it. And the responses that I get is consistent with the research, that 80% of those experience remissions, right? Many of them can overcome a lot of these issues, that it is possible. So what I want to do again with this video is I want to define what that looks like, to give you an idea of what success looks like. And what we're going to do is we're going to go through the 9 criteria for BPD. And now you only need 5 or more to qualify, but that's not important here because what we're going to do, we're going to go through all 9 and we're going to give you an idea of what it looks like when folks have overcome it, or what it looks like when those symptoms attenuate or they're manageable and they're not as interfering in life. Now I've been very fortunate as a clinician that I've worked with a number of folks who have overcome a lot of these issues, who have beaten their BPD, and it is in no way because of me. It is because of their drive, their determination, their ability to overcome this disorder. And I fully give all of my clients their due respect and acknowledgement because they were able to do this with hard work and determination, and they were able to do it. And it's amazing people. And it's great. And there's no reason why you can't do that as well. So let's get started. All right, so here we go. So the first one, this is frantic efforts to avoid real or imagined abandonment. Now what this is, if initially what we're talking about, what this is it's that need to be with someone. It's that need of this intense fear that person is going to leave you. Well, now granted, if you look on the screen, I'll put mild, moderate, and severe. And so you can rate where you feel that you are along this particular criteria. And what happens is that at the lower end, right, that mild aspect or absent, is that you are okay if folks choose to end a relationship. It's okay if folks don't text you back. It's okay if someone cancels a date with you. It's okay if someone doesn't respond the way you expect them to. And it's the way to do this, to get this sense, is to build this sense of self. To build this sense of self that you have, that you're okay without that person. And when you're okay with that, you don't have that frantic efforts and great fear of abandonment. And you recognize that if that person were to leave you and the relationship were to end, that you can find someone else. And it's this belief that you can find someone else. Okay? So it's that comfortability with yourself, and the comfortability that you're in the relationship because you want to be, not because you need to be. And you're very comfortable with yourself. And it's not that drive, that need, like, oh my God, they're going to leave me, I have to do this to keep them, I have to. And a lot of times folks sell themselves out to stay in these relationships, so you're no longer selling yourself out, you're keeping remaining true to yourself. Okay, so that's one. Now the next one, and this is a pattern of unstable and intense interpersonal relationships that are characterized by alternating between extremes of idealization and devaluation. Now what happens here is that a lot of folks that I have come in contact with, when you first meet someone, you idealize them. And you think that they're wonderful. And like a therapist, for example, what I experience a lot is folks who first come to meet with me, we do a consultation session. During that consultation session, and this is exactly why I do this, so that I can sort of manage and deal with that idealization and devaluation. But again, remember, it's on that continuum, right? Mild, moderate, severe, absent, even better. Okay, so that idealization. So when they first come in during that consultation session, we're going to sit down and we're going to talk about. And what we do is we talk about the process of treatment, and I try to get a conceptualization of what they perceive the treatment to be, the course of treatment to be, what they believe I can do for them. And a lot of times folks, when they first start treatment with me, I tend to be idealized, right? So you think, oh, you've written all these books and you've had all these clients and these client successes, so you have all the answers and things like that. And then as we're sort of talking about that, I'll mention to them, I said, somewhere throughout this process, you're probably going to hate me. And somewhere throughout this process, you're probably going to think I'm an idiot, and you're going to probably think that I don't know what I'm doing and that I'm completely incompetent and all these other things. And what folks usually say is, oh, Dr. Fox, I would never think that, da-da-da-da-da. And that's because you're in the idealization, and I understand that, and that's fine. But I also want them to know that we're going to go through that process. And one of the deal during the consultation session is, if we decide that we're going to go forward with treatment, is that we decide that even if you feel that way, even if you hate me, even if you're frustrated with me, even no matter what those feelings may be, that you agree that we talk about it, that you come in and we talk about it. And part of that is, I think, that I also let my clients know that my goal is that when you leave here, to not leave you broken, right? Is that I'm going to try to empower you as much as I can, to build this sense of self as much as we can throughout that session. And we build on these sessions, we continue to build them. And what I have found is that if we build this sense of self, and you build this sense of self-confidence, right? That sense of abandonment, which you just talked about, that tends to lessen. But also does that sense of idealization and devaluation. You start to recognize that people are flawed and that that's okay. That you are flawed and that's okay. That you don't have to be perfect, that nobody's perfect, and managing those expectations and making them real. Because I think the issue of abandonment, a lot of times that's, if you're perfect, then I'll be safe. If you're completely defunct, then I know that you're horrible and I can totally not count on you. And it's a mode of splitting, obviously, right? And I've done a video on splitting. I'll put the link here. So it's part of that splitting, it's part of that understanding. And what happens is you get that better sense that people are flawed, and you accept that. You accept the flaws in yourself. And that's part of that, beating that component of BPD, of doing and managing those issues in a more successful manner. Okay. So now the next one, number 3. And this is identity disturbance. This is markedly and persistently unstable image or sense of self. Now, in this one, what it is that it's that difficulty in seeing who you are. A lot of times in defining your goals and defining where you are, what your beliefs are. A lot of times you may change political parties, you may change social groups, things like that, so that you want to fit in, so that you get this sense of acceptance. But the problem is, if it's unstable, how do you know when you're accepted? And again, that is your mild, moderate, severe, and absent is great. So what does this look like when you're beating this component of BPD, when you've reached this level of success and it is mild or absent? What happens is that you know who you are. You are confident in yourself. You can express contrary views in a appropriate manner, in a confident manner. And if someone disagrees with you, it doesn't internalize. It doesn't mean that you are defunct. It doesn't mean that there's something wrong with you. What it means is that person doesn't agree with you. And you accept that and you move on, because you have identified yourself. How you see yourself remains stable, and your views and values, beliefs and goals are stable because that's what you believe, what's important for you, and what you are comfortable with. So that is that sense of success on that unstable self-image. Now the next one, this is impulsivity in at least 2 areas that are potentially self-damaging. This can be spending, sex, substance abuse, reckless driving, binge eating, okay, and things like that. Now on this one, this one is you can use a lot of behavioral markers for this one, obviously, right? Mild, moderate, severe. Absent is great. And a lot of my clients, these are what I talk about, a lot of those surface structure issues, surface content, and a lot of these behaviors, that impulsivity, the promiscuity, the drug abuse, the recklessness and binge eating, and other types of maladaptive patterns that folks engage in. And what happens is, when they become successful, and they become successful, by successful I mean that they start beating their BPD, they start to have greater control over it. You see that they have greater control over those maladaptive patterns. They have greater control over their response to stressors, those response to situations that are very difficult, that are stressing them out, those stressors that they're having. Now they're using more adaptive strategies, mindfulness. They're using rationalization. They're reasoning, not rationalization. They're reasoning their process a little more. They're recognizing their reaction. They're saying, you know what, I'd like to slash this guy's tires, but I know that I shouldn't do that, and I'm not going to do it. Right? And they don't do it. Whereas in the past, what would happen is that this person maybe, jilted them or cheated on them, whatever it was, and they would just go and just cut up their tires. So, but they don't do that. That is a movement towards success. That's movement of control over that impulsivity. Now, it has to be at least in 2 areas, and we start to see, again, those behavioral markers, that maladaptive patterns start to decrease. So those are behavioral markers. That one's a little easier to see, I think. And certainly in treatment, we kind of mark those and what those responses are and what those adaptive coping strategies are. Now the next one, this is recurrent suicidal behavior, gestures, or threats, or self-mutilating behavior. And again, this goes back to what we mentioned just a moment ago. So we have mild, moderate, severe. Absent is great. And we see that, of course, these folks, these are behavioral markers too. Someone who would cut themselves when they experience this particular level of stress. I like to talk to my clients about, okay, at what level of stress, and it's different for everybody. Some is rather mild, or something that is more frequent, and they go to that sense of self-harm or suicidal thoughts or chronic suicidality, whatever it is, when they are stressed out, and they immediately go there. And that's because they've built up that coping strategy for that. They have found that in their brain is set up that when they have this stressor, that's where they go. Okay, but you can recondition yourself to not do that, to not think, okay, well, I'm going to go to the cutting, I'm going to go to the drinking, I'm going to go to the burning, I'm going to go to the suicide plan and the suicidal gestures and suicidal thoughts. You can do it differently. You can retrain your brain. You have to undo that negative habit. You have to undo that maladaptive pattern. And to be honest, right, and this isn't going to surprise you, the harder it is the further along on that continuum it is, right? The more severe it is, and severe is also frequency and intensity and all these other factors, that is harder, but it doesn't mean you can't do it. that you can beat this. It is possible that you can do that. Okay, so we see this one has behavioral markers as well, and it goes to the frequency, and we monitor that in treatment. I ask a lot of my clients that are self-harmers, I'll say, and it becomes a very casual conversation. Did you engage in self-harm this week? No, or yes. And if you did, okay, walk me through it. What happened, right? We kind of talk about it, and we work through it. And then, over the course of time, hopefully, it starts to go down. They build that level of insight, and they can manage that so much better. Less inpatient episodes, things of that nature. Okay, so that's what that one looks like. Now the next one is affective instability due to a markedly reactivity of mood. Now this can be intense episodic dysphoria, irritability, or anxiety, usually lasting for a few hours, and only in rare instances lasting more than a few days. Now what this is, again, we can behaviorally mark this one as well. And again, this is more of your surface structure issue. And what you see is that these are folks that become so emotionally overwhelmed that they are drowning in their emotions. I did a video on this as well. That affective instability, that it becomes so extreme and so overwhelming that they're drowning in their ocean of emotions. Okay? Or what they're doing is they're hanging off the cliff, just waiting to fall. And that it's very, very difficult, I think, initially, but everyone's on that continuum. It's mild, moderate, severe, and absent is great. And where are they? Well, when someone when we get to the mild or even the absent part, is that they find that their affective reaction, their emotional reaction to situations and issues and problems becomes much more stable, that they may be sad. That doesn't mean you're not going to be sad, right? We have emotions for a reason. Emotions are very important. They tell us, right, how we're feeling, what's going on. They're signals of what's going on inside of ourselves, but also what's around us. So emotions are a good thing. Numbness creates problems. It creates a lot of, I think, uncertainty for a lot of folks. So it is important to have emotions, read emotions, understand our emotions. And I understand this can be difficult for some folks with BPD, and it depends upon where you are on that continuum. But once we get to that mild or absent, you find that your emotions, that you have better control over them, that you recognize when you're sad, you recognize when you're fatigued, you recognize when you're pissed or irritated, or whatever that emotion may be, happy, sad, mad, glad, whatever it is, that you recognize that, but you're not reacting to it, that you're not falling into it, that you're getting a sense of, okay, so I know that I'm depressed, and I'm depressed because he or she didn't text me back, because they didn't write me back, because they stood me up, they said they were going to meet me at dinner in the last minute that they canceled, or maybe there's someone who we could go as far as to say, that you learn your partner is cheating on you, and certainly that is upsetting, but you recognize that your feelings and emotions associated with that, you don't just react to it and become overwhelmed and drowning in that oceans of emotions, and you're hanging off of that cliff about to fall. And you have that affective stability. So you're able to hang on to that emotion. Doesn't mean you're not crying, doesn't mean you're not upset. It's normal to have those reactions, but it is not to the point where it disrupts your day, of course, someone who's cheating on you and your relationship is over, is obviously going to ruin your day. So what I mean is that it doesn't mean the end of your life. It doesn't mean that, oh my God, I'm so caught up in this, and you become unaware and you just have these affective reactions that become instantaneous over and over and over and over and over again. And once you have that reaction, you're able to process that emotion, work through that emotion, and you're able to get an understanding of that emotion. So you feel it, you recognize it, and you process it, and you can work through it instead of just reacting to it and just being on this runaway horse, right? So this horse is just taken off, and it's in the stampede, and there's nothing you can do about it, and then it starts to drag you along, and oh my God, what am I going to do? But instead, once we're at that low end, once we've beaten this component of BPD, you're still riding that horse. You still have that. You're holding on to the reins, and you still have it. And you haven't given up on yourself, and you haven't given up on your value of self. You're still holding on to that. Okay? The next one are chronic feelings of emptiness. This particular component, I find that this can be very complex for a lot of folks. It tends to be a core content issue for a lot of folks with BPD, borderline personality disorder, or those with traits. And the sense of emptiness is that, of course, that's on the continuum, different for everybody. So it's mild, moderate, severe. Absent is great. So you have this sense of this hole inside that can't be filled. It's this black hole that things just keep pouring into it, and you never feel this sense of fullness. And what happens when you have control of it is that you have a sense of connection to self. That connection to self can then be generalized to connecting to others. And that can be something like, so instead of like you're at a party, okay? So when I'm at a party, I tend to meet everybody. I'm very gregarious, very social person. And so I tend to meet everybody, and I like to have fun, and I like to talk to people and stuff. But you have this connection, right? It's fun to meet new people, and they're kind of cool, and they're kind of neat. And, it gives you this sense of personal fulfillment. It doesn't define who I am, but what it does is it gives me a sense of connection to that person, even for that little while. So we're talking, about what you do, what I do, challenges that you may have, and then they talk about different stuff and things that they like and I like, and if there's a movie out, we talk about that and all that other stuff. And but you get a sense of, now that doesn't fill me up, but it's a sense of connection to that person. So I don't have that same black hole, that there is a bottom to that, and these experiences and this interaction fills that. And as I go around the party, you have more connection. And then obviously there are people in my life that are going to fill that much easier than someone I just meet at a party, right? That there are people, that I'm very, very close to. And when I connect with them, it is a more intimate conversation. And it is, if it's someone who I'm very, very close to, obviously, like I mentioned, you have a deeper connection and a deeper talk and a deeper conversation, and that fills up more. You have this sense of connection, like, yeah, that's really cool. But I think that on the extreme end, when you don't have that and your BPD is kind of in control, I think what happens is that emptiness, no matter at that party, you don't talk to anybody, you don't socialize, you don't want to meet anybody, and you just feel empty. And that little BPD, that BPD lens and BPD voice starts to talk to you and say, oh, nobody wants to meet you, you're boring, you have nothing to say, nothing interesting. Let me tell you, the most interesting people that I've ever met in my life happen to have been on the BPD spectrum. They're just fascinating, cool people. So if you're at a party, obviously, you want to measure the things that you say about yourself and not over disclose, but are very fascinating people and very cool and very interesting and very funny and all of that. And they have this great personality. But that emptiness and that BPD lens, which I'll put a link to that video here, but that BPD lens keeps you thinking that, keeps you in that sense of emptiness. Nobody loves you, nobody wants to talk to you, you're empty, and that you have this black hole inside yourself that you'll never fill, and you just keep throwing different experiences down. It doesn't mean anything, and it doesn't really relate because you don't have this sense of fulfilled self. And that's when you start to beat it, when you get this sense of fulfilled self. When you, like the last party I was at, I remember, walking around talking to everybody, and it was time to go. And I remember saying, I killed it at that party. And I'm telling you now, I killed it at that party. I had a lot of fun, and it was really great. But I killed it. And so it's that sense of being okay that, that you killed it. You met a lot of people, and they were really cool, and it was funny, and you were laughing, and they were laughing, and it was cool. But that emptiness takes that away. So when we go to that mild or that absent, you can say that when you leave the party. You're like, yeah, I had pretty good, it was pretty fun, right? And you can enjoy that, and you get a sense of fulfillment from it. Now the next one, inappropriate, intense anger or difficulty controlling anger. This can be frequent displays of temper, constant anger, recurrent physical fights. Now again, for this particular one, these again can be behavioral markers. This goes back to our surface structure content. And what you find is a lot of times my clients that I've worked with that have anger as a particular issue, that we will sort of track that anger, right? Obviously triggers or emotional buttons, things that are setting them off for that. And we'll try to say, okay, well, let's monitor it, right? When is that anger happening? What are the experiences that's triggering that? And we'll also, of course, get to the core content that's driving that, the sense of abandonment, sense of emptiness, loneliness, whatever that may be for that core content. And we'll talk about that. But then we can use markers, right? So we have mild, moderate, severe, and absent is great. But if we can go to that lower end, what you find is it doesn't mean you don't get angry anymore. That's not realistic. Everybody gets angry. Okay, but it's what you do with it. Okay, so it's what you do with it. Yesterday, I got really frustrated, but I mean, I don't act out. I'm just like, oh, I'm so frustrated, and I was frustrated, and then I was like, all right, well, I'm frustrated, and move on because it's over, it's done with. I mean, what happened, and you kind of roll with it, and it's getting to that point, but it's that anger that's when it's driving you, that puts you at that higher end, that more extreme end of the continuum. And when you manage this particular component, is that you manage your anger. Doesn't mean you're not going to get angry. Doesn't mean you're not going to get frustrated. That's not realistic. You're going to get angry and you're going to get frustrated. But what do you do with it? How long do you hang on to it? Anger is a cancer, and it will eat you up from the inside. I've worked with a lot of folks that have chronic anger issues. They're like, I can't let it go, because they're afraid if they let it go, that then they'll lose that energy that they feel like they get from anger. That is inaccurate. And anger is, in my opinion, is not a real emotion anyway. It tends to be an accumulation of other emotions that manifests as anger. Now that can be a whole nother video and things like that. If people are interested, I'm happy to talk about that. But for this particular one, for that intense anger, the way that we're beating BPD for this particular component is that you've controlled your anger, you recognize your anger, and you're not easily drawn to it and responding to it, I think is more accurate. Now, the last criteria that we're going to talk about is transient, stress-related, paranoid ideation, or severe dissociative symptoms. This particular one, criteria number 9, when I work with folks, and if they have a tendency to disassociate, and I've done a video on dissociation as well, I'll put the link here, and if they tend to dissociate, this is kind of where we start. We obviously talk about issues, but this is part of, in my opinion, what the brilliance of DBT is, and Linehan's brilliance, is that she recognizes that if criteria 9 is present, you have to deal with the disassociation first. How can you get to core content if every time you get to intense content, that person disassociates and pulls off? You can't do that. You have to build up that mindfulness, that sense of presentness. This is difficult for a lot of folks because dissociation can be a very reinforcing reaction to intense stress. And for some folks with BPD, when they reach this level of stress, this paranoia kicks in. People are cheating on me, people are stealing from me, people are disrespecting me, people are and all this other stuff. And it sends them off into that extreme reaction, sometimes anger, some of the other things that we've talked about, affective instability, suicidality, self-mutilation, all these other factors. So criteria number 9 is really, really critical, that if it is present, you got to deal with it. Mindfulness is certainly a way to deal with it. And what does it look like when it's successful, right? So we know mild, moderate, severe. Absent is great. And if it's absent, obviously that person under stress is no longer disassociating. They're recognizing the stress. They're recognizing the reaction. If it's an emotional button, if it's a trigger, they're recognizing that. If they used to split as an adaptive strategy, they're no longer splitting. So we're going back to managing that issue, staying present, staying focused, and dealing with it. And that is at that lower end, that is what that looks like. In the comments section, please leave which of these you have beaten and how you did it. And please don't forget, BPD can be beaten, and I want to encourage you to build your knowledge, your insight and skills, and that you can do it. And remember, knowledge is empowerment. Thanks for your time, and have a great day. Bye-bye.